So thank you very much indeed. And as Barry said, keeping to a hard stop of 4. After 3 days in Madrid, I need to get home. And also, some of what I've planned to say, I think, is just echoing what's occurred in previous sessions, and I want to allow maximum time for discussion in the panel. So this is going to be something of a provocation from the wilder shores of scientific research. So, in July of this year, I spoke at the 80th anniversary of the creation of the Nuffield Foundation. And the Nuffield Council on Bioethics is one of the organisations nested within the Nuffield. We're funded by the Nuffield, the UK's Medical Research Council, and the Wellcome Trust. And I was asked to speak to the question of what about the next 80 years and what are the challenges we face? And I used as a framework for that the 3 priority areas that the Nuffield Council has now adopted in its new strategy. And those are reproduction, parenthood and families, mind and brain, and the environment. So I'm going to say a bit about the challenges that are posed by each of those. And then I'm going to try and identify 10 challenges to doing research ethics in these areas. And there may be more. And I know there's an issue being raised about informed consent, and hopefully we can tackle that in the panel discussion. So let me take reproduction, and I should state here, it comes up later, that for 12 years I was a member of the Human Fertilisation and Embryology Authority, which is the UK's regulatory body. And I also chaired it. I was latterly deputy chair of that, and I also chaired what was called its Special Approvals Committee that looked at the issue of licensing genetic conditions for PGD. So we've moved incredibly fast in a short period of time. Louise Brown was the first test tube baby, born in 1978. Since then, we have developed the screening of embryos for inherited genetic conditions that in principle allows parents to choose healthy babies. I should just say that the number of conditions that the HFEA has now licensed for PGD is into the hundreds. And I think during my time on it, I probably helped license about 100. We can also now prevent mitochondrial diseases by what the press slightly unhelpfully called the 3-parent method, whereby the eggs of a second healthy mother are used. Scientists can also now, in principle, genetically edit embryos, though that is forbidden in the UK, and you will probably all know the scandal of Dr. He Jiankui, who was the Chinese scientist who violated Chinese research consent protocols and went ahead and did the first use of CRISPR-R for 3 children. Scientists can also create artificial gametes, and most recently, we can now derive what are called embryo models from living single stem cells. These are from cells created models which then mimic the development of human embryos. And on the much further horizon is ectogenesis, or the possibility of artificial wombs outside the body. So what are the challenges of that? Some at least have predicted the end of sexual reproduction. Though, thankfully, you're going to get at least one joke in this talk, not the end of sex. That may well be the hyperbole of the particular TED Talk commentator who suggested as much. What we have done is radically change the nature of human reproduction, and we've also changed the nature of parenthood and what it might mean to be a parent. So we can ask these kinds of questions. Oh, hello. Beautiful timing, I thought. This is my visual aid. So we can ask, how should we create future humans? Should we continue to recognize what most people think we should, a right to procreate? And is that one we can protect, especially in an increasingly overpopulated world? So the ethics of reproduction have to accommodate the ethics of environmental change. And we know the pressure that's being put on our crowded globe by ever more children. I'm not thinking about you. Should we strive to create perfect children, or only children free of serious adverse conditions? And there are real philosophical and difficult problems about what you understand as the difference between those two. And who has the rights and obligations of parenthood? I said it was very unhelpful of the press to talk about mitochondrial treatment as involving 3 parents. We've had 3 parents for some time. In fact, we've had the possibility of 5 parents where you use surrogates and gametes donated from mother and father. So this wasn't particularly new, but the press rather loved, as they do. What about changes in mind and brain? Well, neural technologies, including brain-computer interfaces that enhance brain functions, do, I think, not just may, radically change what it might be possible for humans to do as thinking beings. And these changes include the enhancement of our moral and cognitive abilities. I'm going to leave someone else to talk about developments in AI. I'll mention it briefly in passing. But those developments have been widely advertised and discussed, and they appear to portend, depending on who you read and believe, everything from the end of work to the end of humanity at the hands of, here's an example I made earlier, super intelligent machines. I should say that the sister organization of the Nuffield Council on Bioethics at the Foundation is the Ada Lovelace Institute that looks at the social and ethical issues of artificial intelligence, and they fall into the camp of modest optimists, not pessimists, who they actually decry as scaremongers. So what are the challenges for us? Well, we need to ask what's the nature and what are the limits of human reason? Indeed, are there any limits if we can enhance in certain ways? If we can have foreknowledge of people's intentions and thus likely actions, and some say that's possible, should we institute preemptive punishment? And this is one for the film buffs. Some of you know it. It's a Steven Spielberg film called Minority Report, starring Tom Cruise and based on the great Philip Dick's novella. And what it imagines is a future in which it is possible for what are called precogs to foresee what people are going to do. And if that's the case, we don't need to wait for them to commit the crime. We capture and punish them before they do so. And when I gave this lecture somewhere else, I said, just imagine in the UK the Home Secretary who could use this. And that's your question for today, which one I have in mind. Perhaps more optimistically, if we can identify what it is that causes people to behave badly, and by contrast, what causes them to behave well, could and should we morally enhance humanity, thereby creating a utopia of the virtuous? And again, some moral philosophers say, what's the problem? If that's what we can do, we can eliminate forever the possibility of evil being done in the world by human beings. Environment, change and challenge. Whatever's the right account of COVID, we know that a future global pandemic of significance will be zoonotic or linked to animals. And we can just predict that with absolute certainty. I have a very good friend and journalist, Jin Shou, who works in China, and has written a fabulous article in Nature about the discovery of the bat cave, where one particular researcher was looking at how bats might be the agents of zoonotic conditions, and she identified disease running into the hundreds. And not all of them would be fatal, not all of them would be very serious, but that's the scale of the problem we face. That means that a future pandemic will be an outcome of the way in which human beings are worsening the global environment through ever-increasing deforestation, climate change, collapse of biodiversity, and the encroachment into the live spaces of non-human animals. So part of why we have the problem is because animals are being driven against their evolutionary mission into the spaces occupied by humans and increasing the risks of creating zoonotic conditions. Thus, it seems to me, whilst we rightly celebrate the achievements of those researchers who very rapidly produced a vaccine that might combat the further spread of COVID, and allow a return to a certain kind of normality, we should acknowledge that the challenge now is to address the causes of further deadly viruses. I am not optimistic about the ability of the UK to learn the lessons of pandemic and be prepared, but that's me, the cynic. So I'm going to ask and pose to you 10 questions, which really are ones about how do we do research ethics in this context of rapidly developing biotechnology and other scientific developments. Firstly, exactly what is research ethics? And you will know that there's a familiar problem of the borderline, if any, between research and clinical ethics, and that's particularly so in the context of new or experimental treatment. So one of the hats I wear is that I'm the philosopher on the Clinical Ethics Committee of Great Ormond Street Hospital for Sick Children in London. And a very frequent question we have to raise is what do we do with pharma who offer us a drug at a reduced rate for a child suffering a serious condition and where all possible other treatments have been exhausted? If we treat the child with that drug, are we doing research or are we just clinicians? It seems to me we're both. But interestingly, in the UK, as you probably know, RECs are regulated nationally. Clinical ethics committees are not. They are subject to various kinds of voluntary exchanges of helpful information, but in the pandemic, there was an explosion in creation of clinical ethics committees, unsurprisingly within the health service. But I want to take another example drawn from another hat I wear. I am currently the chair of the Ethics Advisory Group of the Every Story Matters element of the UK COVID public inquiry. You'll probably know that Boris Johnson, foolishly, agreed to set up an official inquiry into the way in which the government handled the pandemic. And if you read your papers, you will know how appalling the evidence is that's just been disclosed. I had to catch up with Matt Hancock, dearly beloved, of various television programs. Has apparently given evidence today saying it was not his fault, it's everybody else's fault. He was the one who warned them all what was coming, and he's not going to take the blame for anything he did, not even nursing homes. And one of the elements of the inquiry, which more or less completed, is called the Every Story Matters. And that was reaching out to members of the public and asking them to submit testimony about the pandemic and their experience of it, and particularly bereaved families, their experience of the provision of health they got for their family members, and their experience of what it meant to be a bereaved person. Now, I'm having a battle with the inquiry at the moment on this matter. And by the way, I don't get advance notice of any of the WhatsApp messages, honestly, much as I would like them. Is the hearing, recording, analysis and storage of personal testimony, in this instance about the experience of the COVID pandemic, is that an exercise in familiar social science qualitative research, for which certain ethical questions are appropriate, and the group raised them, questions of privacy, anonymity, confidentiality, and support for those who are giving testimony? Or, as I've said, is it an exercise in public engagement? Because much of the testimony will be highly critical of the UK government. And then you have to ask questions about how you use that information, how it's gathered, and the ethical concerns will be ones of trust, inclusivity, consequential impact, etc. All right, second question to ask, whose research? And this was raised earlier before lunch, and who we are regulating and how far we can effectively and ethically regulate and oversee the research of those in the private sector when their imperative is profit, not the benefit of humanity. Various stories have been given as to why Sam Altman was removed from leading OpenAI, only to be put back. And one story is that people were unhappy with his pursuit of a non-profit organization and thereby depriving various people of money. That's one story. But if the imperative is profit and not the benefit of humanity, how do we effectively regulate them? And a nice quote from an American article: the landscape of scientific research, particularly in the context of health and medicine, has seen a significant shift towards a profit-driven approach. And that what goes with that, and we heard not a nice, but a terrible story of how a North American researcher was put under enormous pressure and vilification precisely because what she was doing was challenging the motives of those who were funding her. That can involve a manipulation of scientific methods. It can mean promoting policy reforms that increase a reliance on the relevant industry and its evidence, weaken policies overall, prevent litigation, and overall maximize the use of industry products. And briefly, when I was on the HFEA regulating, one of the biggest problems we had was the growth in the private and commercial sector, which we can't, some of it which we can't regulate. And for instance, direct-to-consumer genetic testing poses huge problems in the UK in what you do about it and the consequences. Okay. Third question, again, was very familiar, I hope, which is the question of what's called dual usage. Namely, that any piece of scientific research can serve several purposes and be used in several kinds of ways. And when should we be troubled about a particular usage? Here's a nice definition from America. Dual-use research of concern is a small subset of life sciences research that, based on current understanding, can be reasonably anticipated to provide knowledge, information, products, or technologies that could be directly misapplied to pose a significant threat with broad potential consequences of public health and safety. And if you want hard, non-abstract examples, we're talking about uses by the military of new technologies to further particular ends of warfare. So we need to ask the question, who's making use of this research, and to what ends is the research being put? What counts as a misapplied research that would raise ethical concerns? Fourth question, at what level, global or national, should we evaluate and regulate research? The problems that humanity faces are clearly global, and if we learnt nothing else from the pandemic, it was that it was a worldwide pandemic with differential impacts on different parts of the world, and that the proper response to it had to be global. The research that may address or solve those particular problems will also be global. So not just pandemics, but clearly AI and climate change. We should raise that question simply because it's sometimes hard to know how effective, robust ethical review takes proper account of that, given enormous national differences in regulatory practice and the weakness of international regulation. In Madrid, at the EU Forum of National Ethics Committees, there was a lot of cynicism expressed in the session on AI, of how either the EU or the UN could do anything effectively to control the developments in AI because we were so heavily reliant on certain corporations who were driving the research and would themselves decide what should be done. Somebody actually at that session said, self-regulation never works. Why should we suddenly think it does? The fifth question to ask is, what exactly is new? Of course, research raises new possibilities. Does it ever raise new ethical questions? Now, that might seem like a flipped question, but there are many who've suggested that science is, as it were, developing in ways that our current ethics can't deal with. So there are frequent citations in the media of a phrase like, this research is an example of science outrunning ethics. And when model embryos were announced to The Guardian, science correspondent said, well, here's a classic example in which science is now outrunning ethics. And I wrote a blog for the Nuffield Council on bioethics that said, balderdash. What might that mean? It might mean that what is scientifically possible lies now beyond the scope of existing regulation. Well, that seems to me perfectly fair, but it's a claim about law and regulation, not about ethics. The kind of ethics that I do, I think, is perfectly capable of addressing the moral questions raised by science. But to instance the problems of regulation, there is what is called future-proofing, and wearing yet another hat, I sit on the advisory group advising the HFEA as to what changes they need to make in the Act to cope with all the recent developments. And the Act is a wonderful one due to the great philosopher Mary Warnock, but it's showing signs of age. And one of the questions is, how do we now change the Act so that we won't need to change it again. Something's called future-proofing. And two key issues are how we define the embryo, particularly how we define a human embryo. I was on the HFEA where we licensed what were called hybrid embryos that had less than 1% animal DNA mixed with human, which was wonderfully treated by the English press, who had no clue what we were doing. But also the famous 14-day rule. And that's the rule that Warnock put into the Act, which is that you cannot do research on any embryo beyond 14 days. And scientists have been pressing hard to change that rule because they think important information can be gained beyond that point. So the HFA will have to decide, do we change the Act or do we put in a provision that allows scientists to do more? Sixth question, what's ethics? The first question in research ethics should always be what ethical issues are raised by which elements of this particular piece of research. And there are two important kinds of failure, it seems to me. One is not to recognize what's ethically salient and relevant. And I have historically had long battles with social scientists who say, our research does not raise ethical questions. Yes, it does. No, it doesn't. Yes, it does. No, it doesn't. A second is to misidentify as ethical issues what are not as such ethical matters. For instance, I did a long survey of all the pre-pandemic global health emergency ethical conventions. And what was very interesting to see was a mixture of what I recognize as clear ethical values, such as equity, freedom, with others such as efficacy, which I'm not sure is an ethical value that gets in there. Trust has been mentioned here, and I want to say now, just to provoke you, trust is an extremely valued thing to have. It is not an ethical value by which we judge various things. Wearing yet another hat, I sit until the end of the year on the UK's National Genomics Board, which oversees genomics research and practice. And I've had a long battle for 2 years to get them to recognize the importance of ethics. And their comment is, yes, of course, of course. What we want to do is foster trust of the government and what it's doing. And my reply is, that is not the point of having a code of ethics. It might be a nice byproduct of having a code of ethics, but trust is not its purpose. The purpose of having a code of ethics is to get it right. I think they've now accepted that. Okay. Seventh question, what's coming and when? Are the outcomes of any research proximate, near to us, or are they distant? And horizon scanning is an exercise the HFEA engages in and the Nuffield Council engages in, identifying what's coming and when. That things are a long way off does not mean we cannot and shouldn't take steps now. And because we can't be sure or predict with certainty what will come when, that doesn't mean that we shouldn't act on, famously, a precautionary principle. For instance, thinking, well, what's the worst possible outcome of what it might eventually be done? Eighth, does ethics apply to input or output? Because often research ethics appears to concentrate on downstream outputs, consequences, and products. And that means sometimes we neglect what happens upstream with the inputs that we have into that process. And this came up in Madrid with the question of AI, where all the discussion by the speakers there was on the use or good use of generative AI and intelligence generally. And someone said, but have we ever looked at how the data is collected that feeds into the algorithm that generates the particular consequences? And the speakers were struck dumb. So why is that an issue? Well, of course it's an ethical issue, because you may be acquiring that data in ways that are completely inappropriate. Ninth question. It's really interesting in the context of AI that I've heard the phrase mitigation of harms and risks. Whereas previously we used to talk fairly obviously about the elimination of risks of harm. And again, in AI ethics, and this happened in Madrid, there was a lot of talk of what can be done to mitigate the possible risks, where that means lessen, reduce, soften, rather than get rid of them altogether. And if harms are bad, which I think they are, there is an imperative not just to mitigate against them and reduce them, but eliminate them. This is where I end with a bang. The last question to ask is, does any research presage the end of humanity? As some now are doomsayers, not just climate change, not just AI, but other kinds of research and obviously global pandemics, and they say we are on the cusp of humanity disappearing. And people of a certain generation may remember the famous doomsday clock that was created by scientists in the nuclear industry. How close are we to nuclear Armageddon? And I believe I checked, we're 10 seconds away at the moment, which is actually alarming because that's as bad as it's been for a while. So, if we ask that question, it seems to be very important to distinguish between the extinction of the human species, the end of humanity, and the end of humanity as we know it. That is, are we only talking about really radical, fundamental changes in that species? For instance, the evolution of a superhumanity, a cognitively and morally enhanced subset of human beings. And filmic reference number 2, those who know Gattaca as a film will be well aware of the prospect of a form of society in which the superintelligence rule over the rest. And what kinds of changes would have to be seen as a change in the essential nature of a human being? It's the kind of question philosophers have asked ever since the Greeks. What is it that makes us special as a species? What distinguishes us from the rest of the world and the rest of the animal kingdom? And if we can answer that question, we might be able to ask what it is that would change that nature of humanity. I've said something roughly like it would be the capacity to see what is right and fail to do it. Seems to me a classic property of human beings. It's the one that religion has traded off for several thousand years. But imagine we create humans who can never do wrong. Do they cease to be humans, or are they nice humans? Take your choice. And rough cognitive equality. At the moment, we're all roughly equal in our cognitive capacities. What if that were to change? So my last question is, and this is where I ask it and then retreat quickly. Would it be a bad thing if humanity came to a full stop? And there are some philosophers, if you apply to me privately, I will give you their names and addresses. And they have said, no, why would it be a bad thing? Think of everything humanity has done to the globe ever since it evolved. It's devastatingly bad. Get rid of them, and let the globe refresh itself, and maybe give humanity a chance to recreate itself in a better form. And that's how I'm going to end with a bang. Thank you.